Hi everyone, my name is Todd Stull, and I am the Clinical Director at Journeys. My job is to lead all of the services that Journeys provides to our neighbors who need it most. It has been my pleasure to be part of a fantastic team at Journeys for over 15 years. I have had the privilege to work directly with people who need help the most. I want to take time to highlight some of the superb work that staff, volunteers, clients, and our other supporters have engaged in. Last January, when we started hearing reports of a pandemic spreading in China, the leadership of Journeys started putting together contingency plans for the different ways the pandemic might play out. One of our most critical decisions was to work with Heartland Health Outreach's nurse practitioner, Mary Tornabene, on how to best protect staff, volunteers, and clients, and continue to provide excellent healthcare services to those most vulnerable. When our shelters determined that they needed to temporarily close to protect volunteers at high risk for serious complications, we were prepared. As we faced this crisis together as a Journeys family, an amazing thing happened. We pulled together. In close consultation with pad sites and volunteers, we completely rebuilt our service delivery model in just 2 weeks. When it became very clear that there was no safe way to continue our services as it was, we moved all of our clients from the shelters into the hotels to reduce their exposure to COVID. Because of some Herculean fundraising efforts and community partners like the Viatorians, we were able to secure donations to pay for those hotel rooms. I cannot overstate how proud I am personally that Journeys was one of the first agencies in the nation to make the decision to move our clients into hotels. In fact, the city of Chicago modeled their program in part on us. Over the last year, we have also switched to an appointment model for clients and limited how many clients could be in the building. We require all persons in the building to be masked up continually. And we've started providing some services like food pantry outside where we can load up cars. And as we shifted much of our counseling and case management over the phone, while these changes might sound simple on paper, they required a lot of preparation and communication. Since March, we've been housing an average of 90 clients per month in the hotels, and we've been also seeing around 150 clients in the Hope Center proper. We have not once closed during this entire pandemic, and through an amazing meal delivery program, which was designed by staff and executed with the generous assistance of hundreds of volunteers, we have served around 60,000 meals to clients at the hotels, which is an incredible number when you really stop and think about it. We've also at least tripled the amount of food pantry that we've given out to clients. So because of this amazing support that we've received from volunteers and the community, Journeys has been able to help those most in need during the most chaotic time we've probably seen during our lives. We continue to do so much. We continue to complete housing applications each week. We continue to place people into permanent housing each week. We continue to help clients get jobs each week. At the start of this pandemic, the fear of what might happen was at times almost overwhelming. Many months later, it is important to take time to celebrate what we have accomplished and how far we have come. Journeys has kept clients healthy and housed and moving forward through all of this. This last year has been one of intense ups and downs. We've had many successes despite the pandemic. Perhaps the greatest lesson the last year has taught Journeys is that when our volunteers and community supporters all come together, nothing will stop us from stabilizing our clients' lives. Thank you for listening and for being a part of the Journeys family, and I hope to see all of you again soon.